Okay, so first we're going to start off with this video of some symptoms that could happen while taking this drug.
It's just like heavy drinking, but a more sluggish feeling. I was dropping Red Devils, Secanol, at first. Later on, I fixed it. Your perception is all out of whack. You can't tell depth perception, how close things are to you. I fell asleep in my car driving. I was lucky I was at a red light. I got woke up by a cop. He didn't know I was under. I told him I'd just gotten off work. Another time I was home. I thought I was acting real good when I walked by my mother. I turned the corner and walked right into a wall. I passed out. I woke up in the same place the next morning.
Can anyone guess what drug that was? And if you guessed barbiturates, that was correct. So the chemical formula for this is C4H3N2O3 negative, and then some brand names are amytal, seconal, budesol, phenobarbital, and it's available in pill, liquid, rectal, and injectable forms. And then some street names are Barbs, Finnies, Birds, Reds, Blues, Yellow, Yellow Jackets, Tuies, Christmas Trees, Goofballs, Pink, Red Devils, and Blockbusters. And here are some different types of barbiturates. So this is the first one is the amytal, which is a liquid form. And then the second one in the upper right corner is the seconal, which is a pill form. And then the bottom one is the budesol, which is also a pill form. So question 1, which of the following is not a street name for barbiturates? I'll give you guys a couple seconds to answer it. And the correct answer is C, Goofies. Pinks, Yellow Jackets, and Christmas Trees are all common street names. So some history behind barbiturates is that it was first developed in 1864 in Germany, and they were first designed as a sleeping pill. And then between the 1920s and 1950s, they were one of the only drugs used as sedatives and hypnotics. And then they started to become recreational use in the 1960s and 1970s. And so what are they? So barbiturates are a group of drugs that have calming effects on the body, and they have similar effects to alcohol in that they range from mild relaxation to the inability to feel pain and loss of consciousness. So this type of drug increases the activity of the chemical GABA, which helps transmit signals in the nervous system. And they are classified as a Schedule 2, 3, or 4 drug depending on how they are used. And they're legal until used for recreational use. So if you have a prescription, then they are legal. But for any other type of use, they are illegal. So true or false, barbiturates were first invented for a sleeping pill. And the correct answer for this is true. And then what scheduled drug are barbiturates? A, Schedule 1, B, Schedule 2, C, Schedule 3, D, Schedule 4, E, depends on the use. And the correct answer for this one is E, depends on the use. So it can either be 2, 3, or 4, depending on what they are used for. So uses for barbiturates, doctors use this drug to treat epilepsy, insomnia, anxiety, severe trauma to the skull, increased pressure in the skull, some types of convulsions, migraines, jaundice, any type of trauma, and then alcohol and benzodiazepine poisoning and withdrawal. And then I found this chart or this graph, and 50% of prescribed barbs are for epilepsy, and the other is for insomnia or sedation. So, which of the following is top use for barbiturates? A. Epilepsy. B. Insomnia. C. Anxiety. D. Both A and B. And that would be D. Both A and B, epilepsy and insomnia. Although they can be used for anxiety, the top two reasons why they're prescribed as of right now is because of epilepsy and insomnia. And then where can someone get barbiturates? Most of these are prescribed. But since they are highly addictive, many people do abuse their prescription. And then other people can obtain them from friends or family that may have a prescription or drug dealers and on the black market. So which of the following are uses for barbiturates? A. Insomnia. B. Epilepsy. C. Trauma. D. Alcohol and benzodiazepine poisoning and withdrawal. Or E. All of the above. And the correct answer for this is E. All of the above. All of these can be uses for barbiturates. So some short-term side effects would be confusion, diarrhea, dizziness, drowsiness, headaches, irritability, low blood pressure, or nausea and vomiting. And then some long-term side effects would be bone pain, tenderness or aching, loss of appetite, muscle weakness, weight loss, yellow eyes, or skin. So which of the following is not a side effect from long-term use? A. Bone pain. B. Loss of appetite. C. Headache. D. Muscle weakness. And the correct answer for this would be C. Headache. That is a side effect of the short-term use. So signs of overdose are confusion, decrease in or loss of reflexes, drowsiness, fever, irritability, low body temperature, poor judgment, shortness in breath or slow or troubled breathing, slow heartbeat, difficulty concentrating, impaired judgment and coordination, weakness, trouble sleeping, unusual movement of the eyes, speech disturbances, staggering, or coma and death. So, since barbiturates are highly addictive, there's a high chance of someone becoming dependent on them, and your tolerance after taking these builds up pretty quick, and typically in 2 weeks, your tolerance will increase. And then overdose may also lead to permanent kidney failure, and it can also be fatal. So, if a person overdoses, it's important to call 911 immediately. And then naloxone is a drug that can help the person regain consciousness and reverse the effects of an opioid overdose. However, it cannot reverse a barbiturate-induced coma. And then about 1 in 10 people who overdose on barbiturates or a mixture of some kind of different types of drugs, but also contains barbiturates, will die from usually a heart or a lung problem. And then true or false, barbiturates are highly addictive and an overdose can be fatal. And that is true. And then withdrawal, some symptoms for withdrawal are restlessness, anxiety, insomnia, stomach cramping, nausea, vomiting, thoughts of suicide, hallucinations, and high fever. And then about 75% of those coming off of barbs have at least one seizure, and then about 66 of people experience delirium for several days. And then the medical care in the hospital is often required to treat the withdrawal from barbiturates. So, which percentage of people will have at least one seizure while withdrawing from barbiturates? A, 66%, B, 75%, C, 83%, D, 54%. And the correct answer for this is B, 75%. So for treatment, treatment for barbiturates almost always requires some medical interference and 24-hour monitoring. So rehabilitation treatment facility that includes 24-hour monitoring by medical professionals is often recommended. And there they'll do the tapering drug dosages in an effort to fully wean someone off of them by lowering the dosage of the drug each day. And then after this, patients will begin cognitive behavioral therapy. And then long-term sobriety can be achieved with the learned behaviors from therapy and support from friends and family. And then some statistics, barbiturates causes about 396 deaths in 2019, and then some were due to the drug alone and some in connection with other drugs, suicide, accidents, or mental illnesses. And then barbiturates led to 1,493 visits to the emergency departments. And then more women than men receive prescriptions for barbiturates because they're statistically more likely to seek help for insomnia and anxiety. It is also estimated that there are 3,000 plus deaths every year from barbiturates overdose in the US. Among these, 42% are classified as suicides, and then the rest are accidental due to overdose or a result of mixing barbs with other drugs or alcohol. And then 6.5 million people in the US misused barbiturates in the past year, which would be 2019. And then each year, doctors write an estimate of 19 million barbiturate prescriptions. So all these statistics were taken in 2019. And then I had a really hard time finding accurate graphs for barbiturates, but I found this one that was used in England and Wales that went all the way up to 2018. And as you can see, they had a really high rate in the early 2000s to mid 2000s. But then it's kind of been going back down in the recent years, which is good to see. So, are males or women more likely to use and abuse barbiturates? A, women, B, males. And the correct answer for this are women. And then some social effects. By taking this drug, it causes disruptive behaviors that impede relationships and then decrease social interactions, lack of interest in activities or hobbies once enjoyed, isolation from social events and activities. And then the financial impact. So this drug, the price of it depends largely on the brand. So example of how the cost kind of differentiates is phenobarbital, which is used for sleep and to control seizures, is about $21 for a certain amount. I think it's like 6 months. And then Butasol is a sleep drug, which is $133. And then Seconal, which is for insomnia or used before surgery, is $1,054. However, most insurances do cover barbiturates if it's for medical purposes. So if you have a prescription for it, most likely your insurance will cover it. And then true or false, all brands of barbiturates are the same price. And then this would be false. And then these are my references.